Hello, I'm Dr. Andy Feltz, optometrist, Chief Clinical Officer for 360 Care. We are the largest provider of ancillary healthcare services to residents of skilled nursing facilities in the eastern half of the U.S. There's a high incidence of ocular surface disease in our population, and the residents really are limited in how they can treat themselves. They need to really be treated aggressively rather than, quote unquote, the real world. And so by allowing our providers to use Eclipse to treat corneal defects, we're seeing great results. Comfort from the patients has increased. The nursing staff appreciates that because it reduces the incidence of severe complications. And we have found Eclipse to be the easiest product to work with and have the best results. Eclipse has allowed us to use the size membrane, the 5mm membrane, which doesn't impact the patient's visual axis, has great comfort, so low complication rate, because the patients can't just come back to the office in a couple days if something's not feeling quite right. And the Eclipse model has, by dissolving faster, gets that healing process started faster for our residents, and that's what we really need. So the smaller membrane is easier for our providers to handle. You know, there's fans blowing in these environments. It's not a controlled situation. And so we find that that product, besides the results, is just mechanically easier for the providers to handle. Our providers really care about their patients, and they want to provide them with the most comprehensive and the best possible care that they can in that setting. And by employing the amniotic membrane therapy using the Eclipse 5mm membrane, they're able to do that. Bring the latest science to an FDA-approved product to their patients to promote healing and increase comfort for the residents. Obviously, for their practice, as a production standpoint, it's the highest reimbursable procedure that an optometrist can do. And so, the cases are there. They identify the cases that would benefit, and then treat them. And that's going to help their production. It's going to help the resident, and it really helps the facility as well because we've made their residents see better, feel better, and need fewer eye drops, which the nurses love. We have a high incidence of patients with dry eye. Now, dry eye isn't in and of itself a condition or diagnosis that qualifies for membrane therapy, but because of the fragile nature of our patients' systemic health, many of those patients have corneal defects. So when we have corneal defects that aren't healing by traditional methods, neurotrophic keratitis, exposure keratitis, severe punctate keratitis, grade 3, we see that all the time. Staining these corneas, photographing those defects, those are the patients that really benefit from this treatment because just artificial tears are not going to heal that wound. And we have to get them over the hump. We have to get them to that healed status, and then we can maintain good corneal health afterwards. But just throwing, eye drops at eyes isn't enough. We've got to get that healing process, and it's really exciting when you come back in for a follow-up visit and you stain a cornea. And it's been great partnering with Ophthalogix. They've given us all the support that we need to help our providers in the field. They provide our kits for us that have everything the doctor needs for that procedure, because we have tweaked what a lot of people do. Now, there are some clinical studies that show what we're doing with pressure patching works, and that's great to have those peer-reviewed studies. But they really support us in what we need out in the field. And the doctors always have a resource for training. I have a resource for providing product, whether that's in a pinch if we need something emergent, or kind of coordinating our rollout and how we get product into our providers' hands. So they've been great to work with.